people being held in Arizona's prisons are suing the people of Arizona. Inmates argue the prison medical services we pay for are so bad they amount to cruel and unusual punishment. The landmark case started 7 years ago, and after many twists and turns, a 3-week federal court trial ended last week. The testimony about Arizona prisons' medical care was both horrifying and jaw-dropping. Joining us is the Arizona Republic's Jimmy Jenkins. He's reported on prison health care for many years, broken many stories along the way, and followed this case all the way from beginning to whenever it ends. Good to see you again, Jimmy.
Great to see you, Bram.
So this case began way back in 2014. Why has it dragged on for so long?
That's right. Well, the way it began was that the parties actually came to an agreement, a settlement agreement. The Department of Corrections said it was going to make a good faith attempt to come into compliance with more than 100 benchmarks that the two parties agreed upon. And so they had several years to come into compliance with those performance benchmarks. They were supposed to do things like make sure incarcerated people have access to their medicine, make sure that when an incarcerated person comes back from off-site treatment, that they are followed up with on-site to make sure that the prison healthcare staff is following through with the best interests of the incarcerated patient. Long litany of things. The department has argued over the years in a series of status hearings that they were making progress, they were accomplishing these things little by little, but over time, they were not able to accomplish all of them at the high benchmark that they were supposed to. And so finally, after years and years, after they were fined 2 different times, more than $1 million for not coming into compliance, Judge Rosalind Silver said, that's it. This has gone on long enough. We are rescinding the settlement agreement. It's going back to trial. And that is what we have been witnessing for the past 4 weeks now in federal court here in Phoenix.
So there was a deal, but the state ultimately couldn't live up to it. How much has this all cost taxpayers as this has played out over the last 7 years and continues to play out?
Right. Well, just think about how we're already paying more than $200 million a year just to provide this healthcare, regardless of whether it's deemed constitutional or not. The taxpayers have also paid tens of millions of dollars in attorney's fees. Keep in mind, Bram, we're paying for both sides of this legal battle. We're paying for to defend ourselves, and we're also paying to the plaintiff attorneys to carry out this case. So the litigation in itself has cost tens of millions of dollars more.
My goodness. Let's get to another, this is a horrifying piece. Some of the witnesses, the inmate side presented, you told the story last week about a severely mentally ill man named Rahim Muhammad. Records show corrections officers tried to control his behavior with blasts of pepper spray day after day, 40 times over the span of 8 months. Why was that happening?
Well, that's a great question, Bram, and that's exactly what Judge Rosalind Silver asked and couldn't really get any good answers for. The Department of Corrections and its healthcare contractor testified that when an incarcerated person is self-harming, committing acts of self-harm, that this is a so-called spontaneous event, and it's hard to respond to. This is, I believe, not true, though, because when a person is having a severe mental illness, when they're presenting in a way that shows that they could harm themselves or even perhaps commit suicide, they are placed into a suicide watch pod. And that's where Mr. Muhammad was. He was in a suicide watch pod, which means there's supposed to be a staff member there sitting there watching him. He should also have access to mental health care so that if he does start committing acts of self-harm, someone could come in, talk to him, counsel him, try to get him to stop the behavior. But that's not what was happening. What was happening was this man was pacing back and forth in his cell. He would walk forward and lunge his head into the prison cell door repeatedly. And what we see in the videos is that day after day, at relatively the same time every day, so really not spontaneous at all, this behavior would occur. The correctional staff would come in. They would say, Muhammad, stop banging your head. And they would tell him again, and then they would pull out a huge can of pepper spray and spray him right in his face, through the cage that they're talking to him with. In other instances, a correctional officer would come in, open up the food trap door, and shoot him with a pepper ball gun, which, Bram, is normally something that is used for riot control. So really brutal tactics used on this man. And what Judge Silver asked is the same question I think I and anyone else watching this has is, if this kept happening over and over, why didn't you do something else? Why didn't you sit down and say, okay, we've got someone here presenting with severe mental illness. He's hurting himself at basically the same time every day. Let's put together a plan and stop this. But instead, they just kept responding with these brutal uses of force, gassing him and shooting him.
One of the witnesses was Arizona's corrections director, David Shin. He's now named in the lawsuit. He's been on the job just 2 years, and he inherited this case from his predecessor, Chuck Ryan. Now, Shin made a jaw-dropping statement about inmate medical care during his testimony. Here's what he said: "They often have greater access to care than I do as a private citizen." What was Shin talking about?
I have no idea, Bram. That's a great question, and I would love to ask him, but he doesn't do interviews. And when everyone heard that in the court, I mean, there were some audible gasps, I think, among the people that were watching. I believe he was trying to say that people who are incarcerated in his prisons are able to access medical care quicker than he was. And that is just not the case at all. It's been proven to be not the case for the past 7 years. This case has been going on. Ask anyone who's ever spent time in an Arizona prison how easy it is for them to see a nurse or a doctor. I mean, most of them never get to the doctor point. To see a nurse, you have to pay money. I don't know if most people know this, but people incarcerated in Arizona prisons have to pay a fee just to put in a slip of paper that says, I have a lump that I'm concerned about. I'm losing my eyesight. We heard from one incarcerated woman, Kendall Johnson, who put in request after request after request because she was losing the ability to walk, Bram. And it turned out after years of no one paying any attention to her, she was finally diagnosed with aggressive MS. This is a woman who was young and healthy. She enjoyed playing basketball when she went into prison. Now she is completely bedridden. And she's testified very emotionally and bravely that she spends most of her days counting the ceiling tiles in the medical unit that she is now confined in. So, if that's the kind of medical care that Director Shin thinks is good, then, I don't know what doctors he's going to, but the statement was just incredible, and it just can't be true.
Can you summarize the state's defense of all this?
Well, from the beginning, the state has said that they are making the best attempt they can to comply with these performance benchmarks. They're saying that they're trying to work within the parameters they have to comply with those benchmarks. They say that they are providing constitutional levels of care. I was actually in the courtroom at the Ninth Circuit Court of Appeals during one of these appeals, and the judges that were on that panel were almost kind of laughing amongst themselves because they couldn't figure out which Arizona prison appeal that was in front of them because there were so many. So yes, I would say this will definitely continue on in the appeals process. But with regard to the trial, Judge Silver said the parties have until January to submit basically their best arguments for what they presented during the trial, kind of a recap and a summary citing those arguments. And then they have the opportunity to respond to each other in February. So I would suspect that we won't get a ruling from Judge Silver probably sometime until March.
Jimmy Jenkins, great work. Thanks so much for joining us.
My pleasure, Bram. Thank you.
You can see all of our Sunday Square Off coverage on our YouTube channel. Go to 12news.com/YouTube.